Thank you, Chair. Nothing to disclose. The other evidence, BPS, like BPS and IC pain sensation, TRPV1 expression in subrachiocerebral nerves increased. OAB site intravesical resiniferal toxin treatment resulted in a reduction in TRPV1 expressing subrachiocerebral nerves, the number of which is increased in the patient with SCI-induced neurogenic OAB. Bladder wall injection. A virus actually goes through the afferent pathway to affect that there and the effect into the bladder and the spinal cord, especially dorsal horn, through the C fiber and A fiber. We have been developing the poreless TRPV1. Actually, delete some portion of terminus to suppress receptor activation. The PP1 alpha is a TRPV1 negative modulator. It has been reported that HSP vector-mediated gene delivery of poreless TRPV1 or PP1 alpha show therapeutic effect on bladder overactivity and pain behavior in rats with acute chemical irritation. In this study, we investigated the effect HSP vector-mediated gene therapy in the storage and voiding dysfunction in spinal cord injury model. We divided mice into three groups. 2 weeks after spinal cord injury, HSP vector were injected into the bladder wall. GFP vector, which is a negative control, and poreless TRPV1 vector and PP1 alpha vectors. And then 2 weeks later, cystometry and Western blot analysis was performed. This slide shows single CMG result. The number of non-voiding contraction was significantly reduced in poreless TRPV1 and PP1 alpha vectors compared to the GFP vectors. This slide shows urodynamics parameters, and non-voiding contraction was significantly reduced, but the micturition pressure at voided volume, residual urine, the voiding efficiency were not significantly differences among three groups. We injected into the bladder wall. Virus can transport it to DRG. And the GFP positive neuron was seen at L6 DRG section. Western blot assay revealed that the lower level of phosphorylated TRPV1 in poreless TRPV1 and PP1 alpha vector inoculated bladders compared with GFP vector inoculated bladders. No significant changes in total TRPV1 levels among three groups. These results indicated that HSP vector injected into the bladder wall were transported to the L6 DRG neurons through bladder afferent pathways. HSP vector-mediated gene delivery of poreless TRPV1 and PP1 alpha significantly reduced detrusor overactivity, evidenced as the reduction of non-voiding contractions after SCI. HSP vector-mediated gene delivery of poreless TRPV1 or PP1 alpha also reduced the phosphorylated level of TRPV1 in the bladder. In conclusion, gene therapy HSP vectors encoding poreless TRPV1 or PP1 alpha, which can suppress TRPV1 receptor activation in the bladder, could be a novel treatment that can avoid systemic adverse events for neurogenic lower urinary tract dysfunction, such as SCI-induced detrusor overactivity. Thank you for your attention.
Thank you very much. Thank you very much, Dr. Suzuki. I can confirm that is your name.
Shimizu.
Shimizu. Yes, I'm not doing very well so far. Any questions from the floor? So one of the questions I had for you, Dr. Shimizu, was the spinal cord transection was complete, but you're reporting voiding efficiency 1 month after the spinal cord transection. So what is the natural history of the spinal cord injury in the population that you've been studying?
After spinal cord injury, after 2 weeks, non-voiding contraction occur and insufficient voiding. observed.
So this is bladder emptying of non-voiding contractions. Yes, so it's slightly confusing to describe this as voiding efficiency.
Uh,
Is this on?
We need the microphone to be.
It's on. Okay, so about the time that non-voiding contractions start is about 1 week. About 2 weeks you start, and about 80% of the animals will start showing voiding contractions that are mediated through the spinal micturition reflex. And these are, I believe, equivalent to Blavis type 2 DSD. So the rat normally has cortical control over this reflex, but following complete suprasacral spinal cord injury, you get a spinal development of a spinal reflex. So preceding a voiding reflex, which may have pretty good voiding efficiency actually, that will be preceded by a series of non-voiding contractions. So there is a void.
So the natural history just needs to be set out properly.
Just one question, and congratulations for your work. I have two questions. How do you address the fact that you target the afferents in terms of location of injection? And what is the number of PFU you inject for having such beautiful results with only few rats?
We injected into the bladder wall 4 sites, left, right,
Okay.
front, bladder dome.
Okay.
Yeah.
And the number of virus you inject?
Total 20 microliter.
Okay.
5.
Okay. Okay. Thank you.
You have any data about the duration of the effect after injection?
That direction.
How long do they respond to the injection and manifest this change?
How long? I don't. That's
Yes,
actually
extension
something
study.
we are looking forward to doing. Coming
Okay.
soon.
Thank you.
Thank you very much.
Thank you, Dr. Shimizu.
So